Hi guys! Today we're going to learn pharmacology by studying drugs one at a time. And our first drug is epinephrine. So let's get into it. First, epinephrine is called adrenaline. It is a naturally occurring catecholamine that stimulates alpha and beta adrenergic receptors. And if you're interested in knowing the ways to remember the adrenergic receptors, you can check the link on the description. I have used the ABCD 123 method. So yep, again, it stimulates alpha and beta adrenergic receptors. Activation of alpha 1 causes vasoconstriction, which increases blood pressure. Beta 1 stimulation can lead to an increased heart rate and contractility. Beta 2 receptor stimulation causes bronchodilation, which helps open up the airways and also cause vasodilation in skeletal muscle vessels. We also have to include that the beta 2 stimulation reduces the release of inflammatory mediators from mast cells, which is especially important during allergic reactions. So we can remember these key actions using the mnemonic ABCs of epinephrine. A for alpha vasoconstriction, B for beta 1 cardiac beats, and then C for clear airways via beta 2 bronchodilation. So now that we know these mechanisms of epinephrine, let's go on to the clinical uses, which is first, it is the drug of choice for anaphylaxis. And also, it is essential in cardiac arrest to help restart the heart. There are also instances like severe asthma attacks that don't respond to inhalers. So, epinephrine can be used to rapidly open up the airways. In pediatrics, the nebulized epinephrine is sometimes used to treat croup by reducing the airway swelling. And when we say croup, it is a respiratory illness, usually in young children, that causes swelling in the upper airway, particularly around the larynx and the trachea. And croup is usually caused by a viral infection. And then another clinical use of epinephrine, which I recommend to remember, is it is used as an adjunct to local anesthetics to prolong their effect. And the mechanism of that is vasoconstriction at the injection site. Okay? And to help remember its clinical uses, we will use EPI is life. EPI, emergencies, pulmonary distress, and injection helper. EPI is life. Now, several other adrenergic agents are worth knowing in comparison, but we will also have a separate discussion about them. But I will just mention them here. We have norepinephrine, as we all know, but it mainly targets the alpha 1 receptors, so it's a stronger vasoconstrictor with minimal bronchodilation. And for us to remember, we will use NE, means norepinephrine, and then NE, no excitement in airways. And then another one, we have dopamine. Dopamine has a dose-dependent effects. Low doses stimulate dopamine receptors that causes effects such as renal vasodilation. Moderate doses affect beta 1, which affects the heart. And then high doses act on the alpha 1, which causes vasoconstriction. Isoproterenol is another one. It's a pure beta agonist, increasing heart rate and causing bronchodilation, but it may lower blood pressure due to vasodilation. And then finally, another example, we have phenylephrine. Is a pure alpha 1 agonist used mainly for vasoconstriction without any effect on heart rate or bronchodilation. So those are just some adrenergic agents that are worth mentioning in comparison with epinephrine. But now we will go back. Let's go to the side effects. The list that we have here include hypertension, tachycardia due to the alpha and beta 1 stimulation. Arrhythmias can also occur, especially in patients with underlying heart disease. Tremors and anxiety are common due to the central nervous system stimulation. Hyperglycemia may develop from beta 2 stimulation, which promotes glycogen breakdown. And there is a serious potential complication with epinephrine, and we call it tissue necrosis, if epinephrine extravasates from the IV line due to intense vasoconstriction at the site. And for this one, we can use the mnemonic epinephrine hits. Okay, to recall this, we have hits means hypertension, ischemia, tachycardia, and shakes. Another important information about this drug, it can be administered in multiple ways depending on the situation. For anaphylaxis, the intramuscular route is preferred. And we have an example product, the EpiPen, if you're familiar with it, which delivers a fixed dose quickly into the thigh muscle. And for cardiac arrest, it is given intravenously during resuscitation. And when used in nebulization, it helps treat conditions like croup in children. And to add another information, epinephrine has a very short half-life, so its effects wear off quickly, necessitating repeat doses or continuous infusion in some settings. And more importantly, epinephrine should be used cautiously in patients with these conditions: cardiovascular disease, arrhythmias, or hyperthyroidism, since its stimulatory effects can exacerbate these conditions. And a clinical pearl to remember is that IM epinephrine is more effective and safer than subcutaneous injection for emergencies like anaphylaxis because it's absorbed more quickly. And oh, before I forgot, it can be also used as a treatment of wide-angle glaucoma when administered as an ophthalmic solution. So that's one of another clinical uses for epinephrine. Right, so I hope that the memory aids can help. And to tie things up, let's picture something, maybe a patient having an allergic reaction because he or she has been stung by a bee, and then you as a healthcare professional grab an EpiPen, and suddenly their heart beats faster, their airways open, and blood pressure stabilizes. This is the life-saving magic of epinephrine in action. Remember, Epi saves lives. If you have questions, suggestions, corrections, or additional information, feel free to put them in the comments so that we can discuss it. And don't forget to subscribe for more videos like this. That's all for now in studying pharmacology, one drug at a time. See you on the next drug.